5 signs of Crohn's disease. While chronic diarrhea and other unbearable GI symptoms may be telltale signs of Crohn's disease, other common symptoms aren't quite so obvious. Maybe that's because this debilitating inflammatory disease of the GI tract can also wreak havoc on other systems in the body. Crohn's can involve the entire GI tract from the mouth to the anus, as well as outside of the GI tract, says Ellen J. Sherrill, director of the Jill Roberts Center for Inflammatory Bowel Disease, a professor of clinical medicine at Weill Cornell Medicine, and an attending physician at New York Presbyterian Hospital Weill Cornell Medical Center. And because the symptoms of this autoimmune disease can mimic those of other conditions, various diagnostic tests may be necessary to get to the bottom of one's pain and discomfort. Here are 5 common signs to look out for, some more expected than others. 1. Diarrhea. Diarrhea that lasts for more than 4 weeks is one of the most common symptoms of Crohn's, and it's caused by chronic inflammation. That said, it's not always Crohn's. Other common causes include IBS, celiac disease, and lactose intolerance, says Sherrill, which is why your doc will likely do a stool culture, colonoscopy, CT scan, blood test, or other diagnostic procedures. 2. Abdominal pain. They say it's all about location, 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 and that's certainly true regarding Crohn's-related abdominal pain. This disease presents in the right lower quadrant, below the belly button, says Sherrill. This region houses the appendix and the ileum, also known as the small intestine, which is the part of the GI tract most commonly affected by Crohn's disease. Sherrill cautions that appendicitis pain also occurs in this lower right quadrant, but appendicitis pain is sharp and acute, whereas Crohn's disease is chronic and intermittent. If you're doubled over with this lower right quadrant pain, seek medical attention immediately. 3. Weight loss. This one makes a lot of sense. If you're having chronic diarrhea and it hurts to eat, of course you're going to lose weight. With Crohn's, sometimes the bowel can become obstructed by foods that are hard and are difficult to digest, like vegetables, corn, popcorn, and nuts. 4. Kidney stones. Kidney stones are an extraintestinal symptom of inflammatory bowel disease, that is, a symptom that occurs outside the intestines. They can crop up because if the ileum is inflamed, it can disrupt fat absorption in the body, and calcium will bind to that fat to create kidney stones, says Sherrill. Studies have shown that the frequency of kidney stones is higher in Crohn's patients than in the rest of the population. 5. Changes in the eyes, mouth, and skin. Here's another way Crohn's can wreak havoc outside of the intestines. All that inflammation can cause sores in the mouth and redness and puffiness of the eyes. You might also notice red, raised areas of the skin that are tender. They may look like spider bites, says Sherrill. Oddly enough, this systemic response can also cause skin tags. The American Academy of Dermatology also links psoriasis to Crohn's disease.